Hello, and thank you for taking time to listen to my analysis of the city of Winter Garden, Florida. My name is Kyle. I'm a student with St. Petersburg College. We'll begin with a quick overview of what will be discussed in the coming moments in this analysis. We will look at the history of the community, followed by the community analysis, which will look at the following: structure, population, environment, healthcare resources, and city government. The last two parts will focus on prioritizing community problems and looking at global community issues. The city was first settled and grew to become known as the largemouth bass capital at Lake Apopka. As tourism grew in the city, another famous feature did, which is the distribution of oranges. And the government took notice. Winter Garden became the largest distributor to American troops in World War II. As pollution grew in Lake Apopka from fertilizers and pesticides, uh, Winter Garden lost its title as Bass Capital, but remained strong in its production of oranges in the 1960s. The 1980s brought a significant freeze, which killed many of the orange crops, and the economy of Winter Garden took a downslope. But the community held together, and from 1994 to 2003, they worked on rebuilding the historical parts of Winter Garden, and today it flourishes with tourism rates of 40 to 50,000 people. Today, the city contains about 30,000 residents and has a population density of 1,190.2 people per square mile. Moving on to the community analysis portion of the presentation, I'll be comparing Winter Garden with a similar sized community called Claremont, Florida. Starting with the structure of Winter Garden, the city holds arenas of interest to keep the community strong, including housing, education, worship facilities, and museums, healthcare facilities, transportation, and social activities. Starting with housing and education and worship facilities, Winter Garden has a wide variety of housing, apartments, condominiums, townhomes, and estates. They also have, through Habitat Humanity, areas for people of low income, and they basically use volunteers to refurbish homes and sell it at a lower rate to people in need and teach them basic home care needs as well as financial classes. Claremont also has similar housing development areas. There are multiple schools that are public and private with different affiliations to Christian and Catholic denominations. These also range from preschool up to high school and also offer dual enrollment to college if certain criteria are met. The schools in Claremont range from public to private, and the private schools are affiliated with denominations such as Catholic and Christian as well. For example, Real Life Christian College. The city of Claremont also has a college campus located and is known as Lake Sumter Community College and is affiliated with a large university, the University of Central Florida. Unfortunately, there are no colleges in Winter Garden at this time. There are many places of worship in the borders of Winter Garden, such as Christian, non-denominational, Catholic, Methodist, Mormon, to name a few. The city of Claremont has many worship centers as well, of many denominations, such as non-denominational, like Real Life Christian Churches, also Baptist, Catholic. Both cities seems to be meeting the community needs at this point. Continuing on with the structure of Winter Garden, the city holds many avenues of health, including primary care offices, dental offices, and central cares. There are many neighborhoods with neighboring hoods which have restaurants, walking paths, clothing, food stores, and upcoming freestanding emergency department. Claremont has similar access points to healthcare, including primary care offices, dental offices, and the Claremont Community Health Center for wellness checkups. Winter Garden has a free to the public museum that portrays the old train and discusses the heritage of the city. Claremont does not have a museum. The community has many areas of social activities, such as the ones listed above, with parks and trails. Many of the parks have access to fishing, boating, docks, tennis courts, basketball and soccer fields, and playgrounds. There are multiple gyms such as LA Fitness in Winter Garden and CrossFit Winter Garden. There are also many avenues of public transportation in Winter Garden, such as the Lynx and Yellow Taxi. Claremont has the same amenities as far as parks go, and the experiences through driving through was the maintenance was better in Winter Garden than Claremont. I saw public transportation along the main highway in Claremont, but none through the smaller roads. Moving on to the community's population, Winter Garden is a diverse population made up of primarily white, Hispanic, and black races. Claremont has the same demographic makeup. According to the population census 2013, there are twice the amount of white people as there are black and Hispanics combined. Both communities share this, and also the employment status of the communities, 90% are working and less than 10% unemployed. In reference to healthcare-related concerns at Winter Garden, there are 3 leading causes of death, which are cancer, heart disease, chronic respiratory disease. City of Claremont also shares similar concerns because heart, cancer, and lung disease are the top leading causes of disease in the nation. There are breathtaking views in the environment of Winter Garden, Florida, as mentioned above. There are multiple parks through city amenities that have basketball, tennis, soccer, and activities. There are beautiful lakes with picnic areas and countless trails, the biggest one of which is the West Orange Trail that runs through Orange County and also through Winter Garden. I've captured a portion of this on the slide above. There are also many other features such as biking, rollerblading, and running that can be done on the trail as well. The parks are maintained by the community and are very clean in both communities from my standpoint, but I felt that the upkeep and view was better in Claremont than it was, or in Winter Garden than it was in Claremont. The city of Winter Garden also has safety measures in place to keep its community protected. They have a fire department with 3 different stations that do joint medical calls with Orange County Fire Department, and at times private ambulance services such as Rural Metro Ambulance. Emergency medical service provide high care in high pressure situations such as cardiac arrest, chest pain, abdominal pains, and respiratory distress. There is also a police department that keeps the people safe from burglary, murder, rape, and out of control traffic. There are attachments to the police unit such as a crime line, tips, and you also have the 911 that can be dialed for emergent situations. The city of Winter Garden also has animal control that can be notified to remove animals such as coyotes, large snakes, out of areas that are around residents of the community that should not be there. Claremont has similar immunities as the fire department, running calls with Lake EMS, also Lake County Fire Department, as well as Claremont Fire Department. Their police department does have a SWAT team, and both communities have a governing body that handles recycling, air pollution, and then the control of water and maintenance of sewage. This brings us to important concern of public health concerns. Although the community has provisions in place that maintain safety and security, there are still dangers I noticed doing my survey of both communities as far as jaywalking, puts people at risk for being injured by oncoming traffic, as well as people using their phones while driving. This just allows me to know that no matter what safeties the community puts in place, people can still be put at risk by other people that won't take responsibility for themselves or for the safety of others. The City of Winter Garden does have a website for disaster planning and different equipments that can be used during the natural disaster storm, and kits that can be used for supplies, but not a evacuation plan that I saw. City of Claremont has a similar issues as far as jaywalking and people on their cell phones, and they do have a disaster plan with evacuation routes. The City of Winter Garden has multiple resources to the community. It uses its healthcare resources such as hospitals and center cares, also has health departments, and it also has home health care and skilled nursing care facilities such as some of the ones listed above. Although the Winter Garden ER will not be built until 2015, this will be a tremendous asset to the community for acute and emergent complaints. The community centers and center cares can also be used for cough, colds, lacerations, and other minor injuries. The ER will make the community affordable and give better access for health care, as community health centers will be cheaper and ERs are accessible but don't require payment. People can be billed later for services rendered. Claremont also has similar facilities such as a full hospital, ER, center cares, and Claremont Community Health Center. for the different healthcare needs of the community and are just as accessible and affordable. Healthy People 2020 developed many objectives for continued health care in the world, objectives that are pertinent to Winter Garden communities such as CD1, which is in regards to reducing overall cancer death rate, since this is the number one cause of death in Winter Garden, Florida. The second leading cause in the city is heart disease. Healthy People 2020 came up with objective HDS-2, which is the goal of reducing coronary heart disease and deaths. Finally, the community of Winter Garden suffers from high incidence of chronic respiratory disease. Healthy People 2020 developed objective RD10, which is to reduce deaths from chronic obstructive pulmonary disease among adults. The City of Winter Garden has scheduled monthly meetings, and its agenda is open to the public and community. The different meetings consist of issues concerning code enforcement, architectural evaluation, community redevelopment measures, to name a few. The officials are accessible through means such as contacting them via the official City of Winter Garden website or filling out a request form for an audience to be approved at a meeting. Many of these meetings deal with community development, and one of which is through building of Horizon West, which is a village-style development with housing, department stores, dog parks, sports centers, restaurants, medical offices, and a satellite college campus. One of the big topics in Winter Garden over the past few years has been the building of a major village called Horizon West, mentioned earlier. This community developed is expected to create transportation access through additional roads, larger development. It is also expected to bring in $100 million annual income and into the community and bring 8,200 jobs. I have assigned these six in this order because Winter Garden battles with heart disease as a top healthcare issue, and the coming ER will help, but in cases of true cardiac emergencies, they have no cardiac center. The closest will be in Ocoee, 10 minutes away. Also, having the ER being built in the community is a start, but will not be a full hospital, so the patients are still needing to be transferred to hospitals outside the community. I labeled the next two because obesity and smoking prevention are some of the two major risk factors for heart disease. There also needs to be better disaster planning in terms of evacuation routes, which I could not find in the disaster plan. Also, there needs to be community hospital for those that want to seek, community college for those that want to seek advanced degrees beyond high school. I have chosen smoking prevention as a community/global issue of choice because this is a major risk factor for heart disease, lung disease, and cancers. The best way for the community nurse to attack this problem would be through primary-secondary prevention. A good example of primary would be to have smoking prevention education in schools to prevent young adults from even starting. A good example of secondary prevention would be through screening forms in schools, or to assess the rates of adults that are currently smoking so that the plan can be formulated. This concludes the presentation. The next couple slides we'll go over references used for the presentation. Thank you for listening.